Hello and welcome to News Across Nigeria. I'm Joke Rogers. On the program today, state governments move to curb the spread of meningitis as a suspected case is discovered in Borno State. The federal government orders vaccines. Come where people of Michika local government area in Adamawa State celebrate the defeat of Boko Haram as they return to their ancestral homes. And Cross River State gets federal approval to generate 21 megawatts of electricity. Welcome to the program. A suspected case of meningitis has been discovered in Askira Uba local government area of Borno State, northeast Nigeria. The Ministry of Health in the state reports that though the patient is stable, tests are still being conducted to verify the type of ailment. Meanwhile, health authorities in Calabar, the Cross River State capital, say they are managing the meningitis situation, although one of the 23 people suspected to have contracted the disease has died.
As of the first week of April, the Nigeria Center for Disease Control reported 2,997 cases of meningitis, with 336 deaths in 5 states in the country: Zamfara, Katsina, Kebbi, Niger, and Sokoto. Now, however, a suspected case has been isolated in Borno State, and given the characteristic quick spread of infectious diseases during conflict and in crowded areas, the state government, which had swung into action, is now on higher alert.
The state is conducting vaccination with meningitis A vaccine in 10 newly liberated LGAs that were not fully captured during the Men A vaccination campaign in 2012 and 2013, with over 350,000 already immunized, while the immunization is still ongoing to cover all children that needs to be covered. However, as we are talking now, we have a suspected case of meningitis in Askra Uba, and as we speak, investigation is ongoing to find out whether it's the usual A type or the C type.
Meanwhile, in Cross River State, where one death from meningitis was recorded at the teaching hospital, the state government is concerned about the increase in suspected cases.
In the very recent past, we had 4 cases almost at the same time, which is not normal for cerebrospinal meningitis in Cross River State, so we're a bit alarmed. And we set up the machinery in motion. The state team is led by the state epidemiologist. We are doing more of symptomatic treatments while still waiting to analyze the particular serotype.
Nigeria lies within the geographical meningitis belt and conducted a major campaign against and largely displaced the serotype A strain of meningitis in 2013.
Meanwhile, the Medical and Dental Consultants Association of Nigeria say they want to offer their expertise and professional assistance to combat the meningitis epidemic. At the end of the National Executive Council meeting and scientific conference in Jos Plateau State, the medical consultants appealed to the government to help them fight this battle by putting measures in place to prevent future incidents.
NEC commiserated with families and governments of states who have lost loved ones to the recent outbreak of meningitis in parts of the country and noted the need for government to institute appropriate measures to combat this epidemic as a matter of urgency. Future incidents can be prevented by institution of massive immunization programs in high-risk parts of the country. The MDCAN members are ready and willing to partner with government in this regard. Epidemics are predictable, like I said. If the government knew that this is a season that meningitis is likely going to be around, measures should be taken to address and stop it, or at least minimize its effect.
Well, the federal government says a response mechanism is already in place to tackle the outbreak. The Minister of State for Health, Mr. Osage Ehanure, told journalists after the Federal Executive Council meeting in Abuja that 800,000 doses of vaccines are being purchased from Europe, in addition to the ones already being administered.
We have mobilized vaccines to come in from all corners. 500,000 doses of vaccines are being distributed, and they have started vaccination campaign already. The government is also getting 826,000 units, which are being shipped from Europe to us within the next few days. The most affected state has been Zamfara, and the next being Sokoto and Katsina. Together, they have about 85% of the cases. There is reactive vaccination going on already with all of these vaccines that I just told you about. There's social mobilization going on. The various teams are working in all the states affected, particularly the most seriously affected ones. There are 2 treatment centers being set up in every local government, and the lumbar puncture kits have been distributed with which doctors can take samples to that laboratory for testing.
Well, with this health situation in mind, the Benue State Governor is upping the healthcare delivery services in the state with the inauguration of 42 primary healthcare centers. The facilities, which come with 6 ambulances, are to serve as referrals between the other hospitals across the state. The special advisor to the governor on development cooperation, Dr. Magdalene Jura, took our correspondent on a tour of the new healthcare facilities.
With the construction of the new ones, we have been able to move patients and the medical personnel to the new structure. We have also given them drugs, because you cannot just have a health facility and then patients will come and there will be no drugs. So we have drugs for them. We also have given them water, as you have seen around here, because water, good water supply has to go with medical care. And then beyond that, we have given them referral vehicles. The idea is to ensure that women and children, because the intervention is particularly targeted at the MDG's goal and then autumn administration pillar for women and children.
Well, there are other health issues, especially in northeast Nigeria. The Yobe State Governor, Ibrahim Gaidam, has asked the World Health Organization to scale up its activities in the state and contribute towards its post-insurgency plans to rehabilitate IDPs. The governor made the appeal when he received the WHO country representative for Nigeria, Dr. Alimu Wandi, at the government house in Damaturu, the state capital. He says the state cannot handle the extent of the humanitarian crisis on its own.
Allow me to congratulate Your Excellency for maintaining polio-free your state for the last 3 years, particularly in the face of the detection of wild poliovirus in your neighboring state, Borno state. You maintained a good surveillance system, and the response to outbreak as one of the high-risk states. Yobe has done very well in doing a quality sub-national immunization services campaigns, as well as the national immunization campaign. We have noted regular support for administrative has been given to supplementary immunization, as I have been briefed by my colleagues.
We decided to galvanize local, national, and global support in addressing the numerous challenges. Hence, we request the World Health Organization to further scale up its activities in our state and key into our collaboration drive to ensure effective and efficient implementation of the envisaged multi-sectoral post-insurgency intervention plan in the state. This will enable us to achieve our set targets of healthier society, embracing sanitation and hygiene best practices, and ensuring cleaner and safer environment.
When news across Nigeria returns, the people of Michika in Adamawa State celebrate the defeat of Boko Haram. Details in a moment. Please stay with us.